See, no surgery is like an art. So, your surgeon should be the artist and the scientist. So, where this will be performed needs to be something like a studio. There are various differences between a dedicated surgery center for rhinoplasty and aesthetics and a general hospital or a multi-speciality hospital. Let me list out the differences one by one. 1. Operation theatre. Usually in a dedicated surgery center, you can operate on your nose as long as the results are achieved. Whereas we have time limits in multi-speciality hospitals, because one operation theatre gets utilized by lot of other specialties and we need to perform at least 6 to 7 surgeries in a day in that operation theatre. Number 2, equipment and facilities will be customized and handpicked in the surgery center, and whereas it has to be rented or got to for that particular surgery, because number of rhinoplasties will not be too many in a multi-speciality hospital. Number 3, anesthesiologist will be in a surgical center dedicated for aesthetic surgery and rhinoplasty will be very much accustomed to having this anesthesia called hypotensive anesthesia, where blood pressure is monitored and maintained at about 95 millimeters of mercury throughout the procedure. Advantage, it reduces bruising and makes the field very clear and surgery more precise. Whereas in multi-speciality hospitals, what happens is the same anesthetist will not stay throughout the 3-4 hours of rhinoplasty. It will be started by some senior and then it will be maintained by some junior. So, there will be some fluctuation when the hands change and there is no absolute control. So, this is an important aspect for the surgeon to have better outcome. And when it comes to recovery, there will be a very personalized care in a dedicated surgery center, whereas in a multi-specialty clinic your recovery will be with people with other diseases and who would have be recovering from other surgeries. So, if you want a more specialized center, like all the people focused on the way your nose job is carried out and you recover better, choose a surgery center. Disadvantage of an aesthetic surgery center over a multi-speciality clinic is you may not get pre-approved cashless insurance. But what happens in most often is that aesthetic rhinoplasty, only part of it is covered by insurance and you may have to go for reimbursement in both the places. So, please choose the place where you undergo rhinoplasty very wisely, choose your rhinoplasty surgeon very wisely, and then think what is the best for your nose job and take a decision.